We hear an awful lot about the 2020 presidential race, but next month, 538 state legislative seats are up for grabs, and the winners of those races, plus more to come next year, will shape the makeup of Congress for a decade. Voters in Louisiana, Mississippi, New Jersey, and Virginia cast their votes November 5th. While President Obama was in the White House, Democrats lost nearly 1,000 state legislative seats. Now they're laser focused on getting them back, and they're punching Republicans on health care.
Sturtevant voted to deny access to health coverage to 400,000 Virginians and expand plans that let insurance companies deny coverage for pre-existing conditions.
Kick people with pre-existing conditions off their health insurance.
Democrats know protections for people with pre-existing conditions are popular. And even though President Trump says he supports those protections, there's been no action, and Democrats smell blood.
Republicans just don't do health care. This has never been one of their strong suits, and it's a real and decades-long problem. It's one of the reasons we got the Affordable Care Act, or Obamacare, is because Republicans have paid insufficient attention to this issue.
Tuesday, a group of House Republicans working closely with the White House released a proposal they say gives Americans freedom of choice, a clear alternative to socialist policies popular on the left.
Parts of that proposal are really strong. They would take the $828 billion of workers' earnings that employers now get to control because of a weird quirk of the tax code. They would give that $828 billion to the workers who earned it. That's a huge change. And then the workers could buy their own health insurance that stays with them as they move from job to job, rather than having their employer choose a plan for them that disappears when they move to another job.
And at the president's urging, protections for pre-existing conditions.
We want to protect pre-existing conditions by treating those who are self-employed the same way we treat those who get insurance through their job.
And how the health care debate turns out could have a lot to do with those state legislative races, because after the 2020 census, those lawmakers will draw congressional lines that will stand through 2030. Jennifer Wishon, CBN News, Washington.